Hello, everyone, and thank you for joining today's webinar, Mental Health Priorities and Suicide Prevention, Addressing the Needs of Autistic Adults. Before we get started, I'd like to go over a few housekeeping items so that you know how to participate in today's event. To the right of your screen is the GoToWebinar control panel. As an attendee, you have the option of listening in using your computer speaker system or by telephone. To switch between the two, select phone call in the audio pane and your dial-in instructions will be displayed. If you're having any trouble hearing me, please send a message through the questions pane and we will assist you. For today's presentation, we will share the PowerPoint handout with you after the presentation. You can download these materials during the Q&A session at the end of today's presentation. You'll also receive a certificate of attendance via email. Since your mic is muted by default, you could submit questions to our presenters by typing them into the chat pane at any time. We will hold off answering any questions until the end of today's presentation. So, since most of you are now here, let's go ahead and get started. We'll now begin the recorded portion of today's webinar. For those of you who just joined us, good afternoon and welcome to today's webinar, Mental Health Priorities and Suicide Prevention, Addressing the Needs of Autistic Adults. My name is Kathleen Hughes and I am your host for today's event. It's great to have you all today. I have the distinct pleasure of introducing today's speakers, Dr. Teal Benavides and Ms. Lisa Morgan. Dr. Teal Benavides is an occupational therapist and an associate professor at the Department of Occupational Therapy in the Institute of Public and Preventive Health in Augusta University. As co-lead of the AASET project, which stands for Autistic Adults and Other Stakeholders Engaged Together, Teal is committed to fostering access to services and supports for individuals on the spectrum. Lisa Morgan is the co-chair of the Autism and Suicide Committee for the American Association of Suicidology. Suicidology. I apologize. She has a master's in special education, is a certified autism specialist, and owns her own consulting company. Lisa is the author of 3 books and 2 resources for crisis support in the autism community, and is a community council member of AASET. And without further ado, I'm going to turn it over to Teal and Lisa. Take it away.
Thanks so much, Kathleen, for that kind introduction. Lisa and I are thrilled to be here today and are excited to share with you the work that we did through a funded project and the resulting ways that this can be applied through community collaborations. I want to acknowledge that the project that will be described today was done as a funded project with input from many, many individuals, and I want to acknowledge my co-project lead, Dr. Stephen Shore, and others who contributed, Mr. Alex Plank, Patty Duncan, and our AASET Community Council. So Lisa and I would like to declare no conflicts of interest with presenting this work. We were funded through a Patient-Centered Outcomes Research Institute, Eugene Washington PCORI Engagement Award, which allowed us to understand the priorities of the autistic adult community. The information we're sharing today is solely the responsibility of our team and does not represent the views of the Patient-Centered Outcomes Research Institute, its Board of Governors or Methodology Committee. So before we jump into the content, I thought we could find out who's with us today.
All right, the poll is open. Just go ahead and please make your selection right on the screen. I'm going to leave this open for about 30 seconds or 100%, whichever comes first. About 10 more seconds. We're almost there. We're almost to 80%. All right, I'm going to go ahead and close that poll and share the results.
Wonderful. It looks like we have a lot of providers who are with us, both of mental health or other health services. We have a mix of parents or caregivers, educators, autistic individuals, and some researchers with us. Great to have you with us today. So what we're hoping you'll be able to accomplish at the conclusion of today's webinar is that you'll be able to identify the top priorities that autistic adults shared were important for mental health research and practice. And so the practitioners who are with us, hopefully you'll be able to gain some insights into the things that the autistic adult community felt were important areas for future work to address. In addition, we also hope that you'll be able to discuss the warning signs of suicide and take into consideration those specific experiences of autistic people that are needed when supporting them when they're experiencing crisis. I do want to acknowledge that Lisa and I are purposefully using identity-first language in our presentation. Identity-first language, such as the use of the term autistic adult or autistic individual, is preferred by many autistic individuals. It acknowledges autism as an identity and not as a disability or condition. We do recognize that people may prefer person first, and it's always important to ask what language people prefer when engaging one-on-one. Identity-first language was the preference of choice by the autistic individuals who were a part of our AASET team, and therefore we continue to use that when sharing the results of this work. We also want to acknowledge that today we're going to be discussing suicide and thoughts or experiences that people may have had that relate to suicide. We are going to be using examples and case illustrations. If this content is distressing to you or results in feelings that are distressing to you, we invite you to leave. If you are experiencing crisis or suicidal thoughts yourself, please call 1-800-273-8255 or text the word HOME to 741-741. We've also placed this in the chat box, so if you need to access this information at any time during our presentation, you can find it there. So I'll start off by talking about priority setting activities, and then I'll transition over to Lisa, who will share warning signs and considerations for autistic adults. So one of the most important things to understand that set the stage for this work is that autistic adults have multiple chronic and potentially preventable healthcare needs as compared to same-aged adults without autism spectrum. In 2016, the Interagency Autism Coordinating Committee, which is funded by the U.S. federal government, identified how research funds were spent on autism research. It hasn't been updated since 2016. However, in the most recent estimates, lifespan issues, which are those topics that address autism across the lifespan, represented only 2% of the funding in autism, or approximately $9 million. In comparison, the research that investigated the biology or underpinnings of autism represented 35% of the funding, and risk factors represented 24% of the funding. This is unacceptable. The lifespan issues that we're going to be talking about today represent people's quality of life and their needs that they have as they age within the United States and our healthcare and other systems. Because we don't have enough information about how to improve quality of life and address those needs throughout the lifespan, our country is at an urgent crisis in which we need to understand how to best prioritize and address those things that autistic individuals feel are most important. Because of this fundamental need to ensure autistic individuals are at the center of any research or practice activities, we looked for any type of priority setting work that had been previously done. Liz Pellicano and her colleagues in 2014 reported that within the UK, there were a number of different priorities that represented things that autistic adults and primarily their immediate family members felt were important. Because the majority of their priority setting group represented family members and professionals, we felt that it was essential to primarily focus on autistic individuals and what they felt was most important. Practitioners, researchers, funders, organizations, and others will benefit from knowledge about how to best address the priorities when autistic individuals are the center of all of those activities. And so we set out to meaningfully include and engage autistic stakeholders in answering the following questions. First, what are the health research priorities as identified by autistic adults? And second, what preferences for engagement and approaches that could be useful when trying to engage autistic adults as researchers in the research process? Today, in this webinar, we're going to focus on the health research priorities that were identified by autistic adults. We used the participatory action research design and established a project team that was comprised of both autistic and non-autistic individuals. As I mentioned before, Dr. Stephen Shore was my project co-lead, and together, along with other members of our project team, including Alex Plank and Patty Duncan, we developed and invited a number of other autistic individuals to participate in a paid community council. In addition, parents and other stakeholders were members of our community council. And overall, we had 18 community council members join and contribute during the 2-year process. During the course of our priority setting activities, we invited other organizations and individuals to come and join us in large stakeholder meetings and small focus groups to share what they felt were the priorities. It's important to note that all actions during our project period were planned, discussed, reviewed, and ultimately approved by our community council. For example, in the beginning of our project, we initially focused on the use of social media to elicit priorities. And during the course of discussions with our community council, they felt that at the time, the Cambridge Analytica scandal was occurring, and therefore, social media no longer represented a safe place where people could share their experiences. And so we changed our course with input from our community council to conduct an online survey and focus groups instead. Our community council contributed to trialing surveys and focus group questions, reviewed consent forms, flyers, and meeting documents, and were an important part of the entire process. If you're interested in some of the things that our community council shared were the best ways to engage and compensate autistic adults during this research process, we shared on the screen a link to our AASET engagement guide. We're not going to be going over the AASET engagement guide, but it's freely available on PCORI's website. So over the period of 2 years, we've engaged the community through a variety of different approaches. We invited people to join us at large group stakeholder meetings, which involved breakout sessions to discuss important topics related to health and well-being. We held these in the first year and at the end of our second year. In between, we conducted an online survey of autistic adults, which over a 2-month period resulted in approximately 250 people sharing with us through open and closed-ended questions the types of things they wanted research to focus on. In addition, we engaged with autistic individuals through 3 face-to-face focus groups. These focus groups were held in rural, urban, and suburban settings. Throughout this process, we really want to point out that we engaged a wide and diverse group of autistic people, including women, men, non-binary individuals, both those who were formally diagnosed and those who self-identified as autistic, and included a wide age range of adults from 18 to 70 years. So before I share with you exactly what we learned were the priorities, what do you think were the top outcomes that people cared about the most?
All right, we've got the poll open for 10 seconds now. We're at 60%. We'll leave it open for about 10 more seconds for you. All right, let's go ahead and close the poll and share the results and talk about the results.
Great. Well, maybe some of you have read our paper on this, but yes, quality of life was the #1 outcome that people identified in our priority setting activities as the thing they most wanted to see addressed in future research and practice. And so 70% of you are absolutely correct. These other outcomes, sleep, suicidal ideation, and anxiety, are also among the top 10 outcomes that people desired, and therefore also represent important areas that we should be considering. Kathleen, can we move past this quick poll, which opened up again?
Sorry about that, Teal. It looks like I have a issue with the polls. Hang on one second.
So while you're working on the poll, I can talk briefly about some of these outcomes. Quality of life overwhelmingly came up as a top outcome. And related to quality of life are all of those other areas that were listed on the screen. So sleep, anxiety, and suicidal ideation are all linked in some way to quality of life. So here's what we learned during our 2-year priority setting process. We heard 3 primary themes of priorities. The first theme were around mental health interventions and outcomes, which I'll share with you shortly. The second theme was about gender inequalities in diagnosis, treatment, and sexual health and well-being of autistic individuals. And third, we also heard that access to healthcare and the needed accommodations to get the care that was needed were problematic and needed to be the focus of future research. As I mentioned, we're going to focus on the mental health interventions and outcomes that set the stage for other collaborations and work that Lisa's going to describe related to suicide. If you're interested in these mental health interventions and outcomes, this paper was published in 2020, Listening to the Autistic Voice. It is an open access article, which means you can freely obtain it. Mental health priorities to guide research and practice. So our top mental health research priority was trying to understand the impact of trauma on mental health outcomes that autistic individuals experience across their lifespan. So throughout the priority setting process and in multiple venues, focus groups, surveys, and large stakeholder meetings, people described experiences in which they had had adverse childhood experiences, both as a child, as an adolescent, and as an adult. And that type of trauma resulted in long-term experiences and mental health needs. So autistic individuals wanted to know what can be done to effectively address trauma through, say, trauma-informed care or other approaches that are effectively tailored for autistic individuals. Relatedly, autistic adults wondered what were the best indicators or measures of post-traumatic stress disorder, trauma, and adverse childhood experiences as experienced by autistic individuals. Many people mention that the way in which trauma, PTSD, and ACEs were expressed among autistic individuals may be different than in the general population, and that this was an important area so that we could help screen and identify people who have experienced trauma and better link them to help and care early on in their lives. The second mental health research priority really focused on the impact of social isolation, stigma, discrimination, and other forms of marginalization. So we heard many stories in which people's lifelong experiences being discriminated against or marginalized and having to explain autism and their experiences or desires or needed accommodations resulted in feeling different than or separate than. And they wanted to know what this does in terms of mental health outcomes and how to solve this problem of social isolation and stigma. Some individuals during discussion brought up other forms of switching the lens and wondered what the impact of radical inclusion or being a part of a social movement or identity and how that would impact mental health and well-being. These are questions that are actively being explored by researchers, but still need continued research to help understand how to address these very impactful experiences. A third mental health research priority was when, for who, and under what conditions do self-managed interventions and preferred activities can be used to address well-being and mental health. Not only that, but how do these self-managed interventions or approaches improve quality of life and reduce mental health symptoms among autistic individuals? Throughout our priority setting process, people talked about needing to self-manage their own mental health and desired to be able to do this on their own in the communities in which they lived and worked. They did not want to see professionals receive referrals or take medications in order to manage their mental health symptoms. When asked, people wondered about how effective community available approaches such as exercise, physical activity, yoga, mindfulness, meditation, Tai Chi, animal-assisted therapy, art, and music-based approaches were in helping autistic individuals manage their mental health. In a systematic review, we identified a number of different things that have been investigated for improving mental health among autistic individuals. And none of these things have been clearly investigated with the exception of mindfulness and meditation. One of the important things to note here is that these activities do not require access through a healthcare provider. Again, people wanted to be able to self-manage their own mental health and wondered about evidence that would support that. So these are things that we should be considering when planning and addressing mental health among autistic individuals. And last but not least, our fourth mental health research priority were about the potential long and short-term negative side effects or adverse outcomes of currently recommended therapies. Individuals mentioned that they had experienced long-term negative experiences with interventions they had had as a child, and they wondered what types of research was being done to measure those side effects or adverse outcomes. When we investigated the literature, very few of these interventions have been studied long-term. And so the recommendation here is to better measure and understand those side effects or adverse outcomes of currently recommended therapies as an individual ages. So not just at the time of intervention, but also later as that person grows up. We also learned that measuring quality of life, depression, anxiety, social well-being, and sleep was an important priority, mainly because individuals reported that the standard ways in which these are measured did not always capture their experiences as autistic individuals. And those experiences that they had through different questionnaires or other ways of measuring things such as quality of life were not sufficient when thinking about future research and practice. And therefore, one of our priorities is to suggest that we better develop measurement tools that specifically target autistic quality of life and the experience of depression, anxiety, social well-being, and sleep. In terms of outcomes that matter to individuals, we did learn that suicide attempts and suicidal ideation were among the top 10 outcomes that matter to individuals. And this is notable primarily because we had a number of different outcomes that people could select. And when they chose outcomes that mattered to them versus outcomes that didn't matter to them, suicidal ideation and suicide attempts did come up across the board, both through focus groups and through our survey. And this is important to note because suicide in and of itself is a critical indicator, as Lisa is going to talk about, and impacts the autistic community greatly. So to summarize, mental health matters across the lifespan. However, we don't have sufficient research funding to support practice for autistic adults. We need to equip people with the skills to live a fulfilling life and the information to help them self-manage their mental health needs. Focusing on deficit-based approaches were not ideal for promoting self-worth and came up as something that was traumatic and harmful as a person aged on the autism spectrum. And so we're suggesting that a paradigm shift needs to occur to create spaces and places where people are accepted, feel like they belong, and are encouraged to pursue their interests and goals. We also need to assume competence and self-determination and people being able to make choices about their lives and about what matters to them. So what I'm going to do now is I'm going to turn it over to Lisa, who's going to talk about her work related to developing a toolkit and other resources for understanding warning signs among autistic individuals. Lisa, take it away.
Thank you, Tia. Okay, now I'm going to be discussing considerations to take when assessing and supporting autistic people using the warning signs of suicide for the general public. I'm going to start with a poll. Which of the following is a leading cause of death in autistic people? Kathleen, are we going to do the... There we go.
All right, we have about 10 more seconds and we're at 62%. Let's see if we can get to 100%.
Yeah, I'm not sure this was the right question.
Oh, I apologize. That was the only poll I had left in the system. Let me go ahead and close it.
Yes, please.
Okay.
We'll just go on and I'll just keep talking about, I'll answer the question through my slides. So why do autistic people need crisis support? It's because of the following things here. A diagnosis of autism is actually a risk factor for suicide. And a study done by Cassidy et al. In 2018 showed that 60% of newly diagnosed autistic adults reported suicidal ideation compared to 17% in the general population. As well, 35 had planned or attempted suicide compared to 2.5 in the general population. Also, masking and camouflaging is something that a lot of autistic people do to fit in to society. And unmet needs are a lot of things that autistic people also are challenged by, and they are all unique risk factors of suicide for autistic people. So suicide is a leading cause of premature death in the autism community. So the purpose of the considerations for warning signs toolkit is to first understand the need for considerations, to recognize the differences in autistic people, and to support autistic people as autistic people. The structure of the toolkit is that it states the warning signs for the general public first, and then taking each of those warning signs, it shows considerations and the need for considerations for each one, as well as showing how to support autistic people in crisis. These are the warning signs of suicide for the general public taken from the American Association of Suicidology website. In the following slides, I'm going to take each one separately and show considerations to take when using these warning signs for autistic people. The following explanations are considerations to pay attention to when supporting an autistic person for suicidal ideation or attempt, but please don't make any important life-altering decisions based on the information. All the warning signs for the general public do pertain to autistic people too, with considerations about aspects of autism. This information here is to broaden existing knowledge about autistic people. And then also something to remember is autistic people know the most about themselves. And for professionals to be supportive, the best thing they can do is to make space for autistic people to communicate to them what they need. Okay, can we put that other poll up here, or should we just go on?
Okay, Lisa, we have the other poll open.
Yeah, this was the one that was supposed to be first.
Yeah. Apologize. Would you like me to close it?
Yes, yes, please. Okay, so moving forward, one thing to remember, here's some things to remember about autistic people in general. The thinking process of autistic people is typically very literal, and to support them would be to consider the exact meaning of what you say to them as you're supporting them in a crisis. And to remember that autistic people will answer what they're asked in a literal way and may give a response of what was asked, but it might not be the information the person who is supporting them is looking for. So, for example, if somebody supporting an autistic person in crisis asks them, do you want to hurt yourself? Or even, are you thinking about hurting yourself? Well, they may not want to, and they may not be thinking about it in that moment, but are planning to hurt themselves to escape pain or some type of negative situation. And so just being very, very literal and understanding that's how they're going to answer would be supportive. I know of someone who had self-harmed and then actually had an exercise class the next day, and some well-meaning people who saw her kept asking what happened, and she said, I cut myself. And then she would get either, oh, okay, well, maybe you can exercise tomorrow, or something along the tune of acknowledgement of what she said, but not too much interest. But this person was autistic, and she was literally saying to the people that were asking her that she cut herself. It was a self-harm situation that people weren't picking up on. She finally actually pulled some people aside and explained that she was having difficulty and did get the help that she needed. But it's just so important to ask exactly for what you need or exactly what you want to find out. all the information about communicating from the Autism Crisis Toolkit, which is the link is at the end of this presentation, is relevant in helping to support autistic people in crisis. Another example is maybe possibly asking a question that's too general or too vague. And it actually may render an autistic person speechless because there are so many different ways a vague question can be answered. And again, the autistic person may not get the help they need. So for example, how are you? There's so many answers to that question. Or what do you need? And an autistic person may think, well, I need a job and I need a home and I need companionship, and just be so overloaded with what they need, not understanding that they're asking in the moment. So a better question would be, how can I help? That's more direct and literal. Okay, the first warning sign for the general public is increased substance, alcohol or drug use. And this is typically not a challenge for most people on the spectrum. They may actually just be stimming or possibly regulating themselves. Stimming can be anything from hair twirling to drumming fingers to nail biting or pulling hair, making loud noises, pacing, or even hitting themselves. A consideration to take would be for autistic people to know that autistic people may be presenting in a way that is misunderstood. And the solution would be to investigate the situation further to understand what the autistic person is experiencing in that moment. Instead of automatically reading the situation, try to find out what the autistic person is truly doing in that moment. No reason for living and no sense of purpose in life. This warning sign for the general public. A consideration to take may be that the autistic person may feel this way due to social isolation. And what could be the consideration is that comments such as I don't belong to this world and I never fit into this world are actually being said because they have a long history of not fitting in with peers or even colleagues as they get older into adulthood. So these statements may just be the reality of an autistic person not belonging to the world culturally, socially, or even environmentally, with sensory issues such as the lighting being too bright, the temperature not being correct for the person, sounds, smells, touch. So many things can bring them to the realization or the thinking that they just don't belong to this world. So the solution would be to investigate further to understand exactly what the autistic person is communicating. And investigating is listening, really listening to hear what the autistic person is saying. An autistic person's processing time may be slow, especially if they're in a crisis situation. So giving them extra time to answer your questions or to explain themselves would be very supportive. Anxiety, agitation, and sleep issues. These are all symptoms. These symptoms are all aspects of autism. So that's the consideration. And how might one know if they are signs of suicide? Again, investigate further using concise, specific language during any assessment or crisis call or text. And investigating specifically any changes in levels of anxiety, agitation, or sleep issues. So for example, if an autistic person lives with anxiety and has certain self-care techniques that work for them and keep their anxiety at an acceptable level, and then suddenly the self-care techniques are not enough and their anxiety continues to be at a high level most of the time, that would definitely be a cause for concern. The warning sign, feeling trapped. Autistic people can't escape their autism or how society and our culture treats them. There is no way out, and an autistic person will most likely be very honest about that. So the consideration would be, is saying the truth about one's life as an autistic person a warning sign of suicide? And again, the solution is to investigate further with clear, concise, and literal language to find out what the autistic person is really saying. So for example, there may be several misunderstandings in a row in a morning, and or several instances of miscommunication with different people, a neighbor, a mother-in-law, a friend, a person at the store. They may experience negative social interactions and then have someone question their motives because they didn't display the right emotion for a circumstance they were involved in. And it can go on, and they can truly feel trapped by their autism. Hopelessness, well, it's a myth that autistic people do not have or feel emotions, but also many autistic people can't identify or express their emotions. And with autistic people being typically honest, an autistic person may feel hopeless and say they feel hopeless because it's true, but it could be a word choice, not an emotion. So investigating further, using that clear, concise, literal language that we talked about, also keeping in mind the autistic person may truly feel hopeless, and it is a warning sign. It's worth the extra effort to determine exactly how the autistic person is using the word to make sure they're supported in the way that helps and does not unintentionally harm them. Well, withdrawal. This warning sign for the general public is actually a coping mechanism for many autistic people. Autistic people feel the need to withdraw from sensory issues, social interactions, or even external expectations that exceed their ability to cope. It will be different for all people. It also may be a warning sign for suicide. So determining any changes in the level and or type of withdrawal would be really important. So the consideration would be withdrawal may be used as self-care by the autistic person. And the solution would be to investigate any changes in withdrawal patterns or behavior. Also, something to keep in mind, what may be overwhelming for autistic people may be, hate to use the word, but normal for non-autistic people, and you can't go by normal. An example might be a person has a pattern of withdrawing after work, school, or social events, and the autistic person withdraws for a certain period of time and then is refreshed and regulated. But suddenly, if they withdraw for longer periods of time and are not as refreshed or as regulated, that would be a cause for concern. Rage, uncontrolled anger, and seeking revenge. An autistic meltdown can look like rage and uncontrolled anger. And what a meltdown is, it's an intense response to overwhelming events. It can be caused by sensory overloads as well. Autistic people have difficulty expressing their emotions, or many autistic people, and it's an involuntary coping mechanism. A true autistic meltdown cannot be stopped by will or want. So the consideration here would be that the autistic person is reacting to an overwhelming situation. A solution would be to keep the autistic person safe until the meltdown is finished. Do not overreact. Show empathy. Remember, an autistic meltdown is not a temper tantrum, and it can be frightening, just as frightening for the autistic person as it is for the people supporting them. acting reckless, or engaging in risky activities. Being misunderstood is common for autistic people. Overthinking a situation and reacting in a way that can be perceived as risky or reckless, or perseverating or deeply thinking and appear to have made a reckless or risky action or decision. These things can be happening. An autistic person could be impulsive and suddenly make a decision that looks reckless or risky. They may be confused by a situation, or they may be stimming. And again, stimming can look, it can look reckless. Possibly a person is pacing and they may pace into traffic or something. The consideration to take is the autistic person is presenting differently than what they are experiencing internally. And the solution would be to understand autistic people are misunderstood, and the autistic people you are helping do think differently than non-autistic people, and just try to see the person before you as who they are as an autistic person. Dramatic mood changes. Well, these can be caused by many different things, such as overwhelming emotions, sensory overload, or change. These mood changes will be different than autistic meltdowns in that you can probably talk to the person and help them to see the situation in a different way. I can share a personal experience that I had attending a grief group. We had just all got settled in our chairs, and a facilitator came in and said, "We have to change. We don't have enough facilitators for tonight. We all need to move into one group." And all of a sudden, the members of the group got up and grabbed their coffees and grabbed their coats, and they were all talking. And I just burst into tears. It was too much change. I couldn't process it in time. And I think you feel vulnerable in groups anyway. But I had one group member who said, "I'm going to sit with Lisa until she's ready." And then she did just that. She sat, she was quiet, she waited while I regulated myself. And within about 10 minutes or so, we were able to join the other group. And while I wasn't able to participate, I was able to be successful in staying until it was over. So there may be other causes of dramatic mood changes in autistic people other than it being a warning sign for suicide. So a solution would be to reframe the situation to help them perceive what happened in a different way that could possibly help. Giving away prized possessions or seeking long-term care for pets. There are autistic people who have strong emotional connections to their possessions, and many who are very much connected to their pets, some of whom serve as therapy pets. And while many people probably remember having a special blanket or a teddy bear or a doll that they were very attached to as kids, autistic people may use more obscure objects such as batteries, fruit, cereal boxes, or even sticks to be comforted and use them as a coping mechanism. And that would go into adulthood. Autistic people can have an attachment to objects throughout their lifespan. A consideration to take would be for autistic people to know that autistic people have different levels of attachment to objects as a way to cope. And this may be a warning sign of suicide for autistic people if they do have that special attachment, that strong attachment to something that they suddenly want to give away. And a solution would be to understand attachment to objects may be different for autistic people, and further investigation is necessary. And that is the last warning sign of suicide for the general public. And so just something to remember, that they are as pertinent to autistic people as they are to the general public, only with these considerations to take to make sure that autistic people are supported and not unintentionally harmed.
Thank you so much, Teal and Lisa. That concludes the presentation portion and begins the Q&A session of today's webinar. If there are any time-sensitive or urgent questions, please contact the crisis hotline at 1-800-273-8255 or text HOME 741-741. If you have a personal question, please email it to the speakers and they will respond after today's webinar. And during the Q&A session, we'll answer general questions. So please phrase your questions in a way that does not involve particular individuals. And as a reminder, you can still submit your questions through the questions pane in your control panel. So our first question is, why do we need these considerations for autistic people?
I guess I'll take that one. If you don't have the considerations for autistic people can be harmed in being misunderstood. So it's very traumatic to be taken away in an ambulance or to be in a mental facility where because they think you're suicidal when you're not. And so the considerations are very important to help professionals to understand autistic people and what's truly happening to them in the moment.
Okay, so our next question is, I've seen different warning signs on other suicide prevention websites and organizations. Would those also need considerations, and how would we know what they are?
Yes, there's no standardized list of warning signs for the general public. And yes, I do believe that they probably all would, it would be good if they could all have considerations for warning signs for autistic people. I use the American Association of Suicidology's warning signs on their website because I'm affiliated with them. I'm the co-chair of their Autism and Suicide Committee. But yes, you're right. There's no standardized general warning signs for the general public.
All right. Where and how did you distribute the survey to autistic adults?
That's a great question. So we elicited the help of organizational partners, both those that are autism organizations and non-specific organizations, such as the Association of University Centers on Disability, to share the link of our survey. We also asked our community council members to share it on their personal social media pages to get the word out to communities that may not traditionally be members of those organizations. And we also used targeted Facebook advertising to boost the availability of that survey link to groups that express an interest in autism.
So the next question is, do you have a guide for when you are looking for a therapist?
That's a great question. Lisa, do you want to tackle that one? I assume the question is asking about seeking a mental health therapist. Is that the question?
Star, if you want to put a, let's see here, resources to give to youth, not the parents, self-advocacy resources, perhaps.
To take with you when you go to see a therapist? If it is that, I don't know of any offhand, but I am planning on writing them in the future. So I don't know of any offhand right now.
All right.
So
sorry. Go ahead, Teal.
Kathleen, do you mind if I just jump in real quick?
Please.
So the American Association of Suicidology also has available on it this resource that Lisa mentioned. So this might be worth sharing with anybody who you're planning to work with so that they can read about it. So the warning signs, considerations for autistic people are on the American Association of Suicidology's website, as are considerations for people in crisis, autistic people in crisis. There is also a toolkit for that as well that Lisa and the committee developed. And so those are two tools that people might want to share. There are a number of other published articles that people might consider bringing with them, since providers do look at the published research. And Sarah Cassidy and Brenna Maddox and colleagues and Sherry Yeager-Hyman at University of Pennsylvania have all been doing research on suicide and autism here in the US, and Sarah Cassidy is in the UK. So if people are interested in specific articles that they might want to share with providers, would be happy to provide those after the webinar.
All right, it looks like we have another question here. I'm finding a lot of autistic individuals that I work with use suicidal language, but don't seem to understand the meaning behind it. Do you have any suggestions to help them understand the meaning of their statements?
So
I think, go ahead,
ahead,
Tim.
Lisa.
Oh, I was just going to say, one of the common things that happens when people are talking is autistic people tend to use the words as the definitions in the dictionary, just the literal meaning of the words. And non-autistic people tend to use the nuanced and slang and more figurative language. And it may be just a case where they need to together define what these words mean that they're trying to use to communicate to each other.
Jill, did you want to make a comment, or shall I move on to the next question?
No, I completely support what Lisa said. It does sound like a miscommunication that needs to be determined before progress can be made to understand how to best help that individual. And if the words that are being used are not helpful, maybe try to consider the use of pictures or images, something that's not necessarily auditory.
All right, looks like we have time for one or two more questions. What was the racial ethnic breakdown of the ASD individuals who participated in the study? Were there any significant differences in outcome priorities amongst the different groups?
That's a great question. We did, I don't have the exact breakdown by race, ethnicity in front of me. I'd be happy to get that to you. It is in our demographics section of that article, so you can pull up the exact numbers. We didn't have as much racial ethnic diversity as we wished, but there were no significant differences between groups by race and ethnicity, although we did find significant differences by gender in some of the sexual health and well-being priorities, which are not yet published. We did examine, in addition to that, by looking at differences by gender. And when I say gender, I mean people who identify as female, people who identify as male, and people who identify as non-binary. So we did see differences there. We also were interested in trying to understand whether or not people who self-identified as autistic versus people who had who reported having a formal autism diagnosis differed, and we didn't find many differences there.
Okay, so our final question here for today is, do you have any guide for when youth are looking for a therapist?
Can you repeat that question, Kathleen?
Yeah, it says, do you have any guide for when youth are looking for therapists?
Any guide for when youth are looking for therapists?
Yes. I have one more that came in. Shall I just go ahead and address this one and we can take that one offline?
Well, I do think it's a personal decision when you're looking for a person who's going to help, engage in assisting that individual with their mental health needs. So, part of it is identifying whether or not that therapist is interested in understanding autism and the specific ways that individual may need to express their needs in the therapeutic relationship. And so part of it is finding out whether or not that therapist has worked with individuals who are autistic or is interested in learning more to specifically help that individual. Unfortunately, there is no, to my knowledge, national registry of people who do express comfort or have worked with autistic individuals. So I think that is definitely a need. There are some programs that are going on and research that's going on to help inform healthcare providers through use of programs such as the ECHO model, led by Kristen Soule at University of Missouri and others, seeking to help spread knowledge about autism and support providers in delivering best care. But as of right now, I don't know of any specific resources that would help people identify therapists. Lisa, do you?
No, I don't.
Okay, that was the final question. Do you each have anything to say before I sign off?
No, if you could go to the last slide for us, Kathleen. I think we wanted to say thank you to our the audience and to especially the individuals who participated with us in the priority setting activities, as well as the Autism and Suicide Committee of the American Association of Suicidology. On the next slide, Kathleen, is our contact information, which please, I know that there are probably other questions that did not get asked. You're welcome to contact Lisa and myself at these emails. And feel free to check out the Crisis Support Toolkit and the Warning Signs Toolkit on the American Association of Suicidology's website. So thanks again for having us today.
Yes, thank you.
Thank you so much, Teal and Lisa, and thank you everyone for joining us today. If you found today's event helpful, we encourage you to register for OAR's next health webinar event about the Aspire, AASPIRE Healthcare Toolkit on April 15th at 2 o'clock Eastern Standard Time. Once you close out of today's event, you'll receive an exit survey. We would appreciate that if you would complete that and provide your feedback. Everyone will receive a follow-up email with a link to today's video recording and materials within the next week. On behalf of the Organization for Autism Research, thank you for joining us this afternoon and have a great rest of your day.